everyone. During today's short lecture, I will explain to you briefly about the pain management. Pain, as we know, is a very uncomfortable feeling which could be experienced by everyone throughout the life. Therefore, it is really important for us to understand how does pain occur and what kind of treatments we should receive to properly cope with pain and reduce the pain level. So let's first have a look how does pain occur. Now, in our body, there is a very important body system which is called the nervous system. Nervous system can be divided into central nervous system and peripheral nervous system. Central nervous system include your brain and spinal cord. Peripheral nervous system include all the nerves that spread around your body. Now, nerves exist on your skin, on your muscle, on your bones, on your internal organs. Every part of the body have the nerves. Now, the nerve help us to sense the signal from the external environment and then send the signal through the peripheral nervous system to your central nervous system to be processed. And then after the signal is processed and interpreted by your brain and spinal cord, it will then send the central nervous system will then send the command to the peripheral nervous system to tell your body how to react. So then let's have a look at the pain. Pain is a signal. For example, you touch, it sounds like a knife is cutting your finger. Some injury actually happens on the finger. On the finger, you have a lot of nerves. On the top of the nerve, there is a pain receptor, which is called the nociceptor. Nociceptor actually helps to sense the pain signal, sense the injury. So after the nociceptor actually sense that injury, it will then be carried by the nerve and then will send through your peripheral nervous system to your central nervous system to be processed and interpreted. So your brain will recognize the injury and then will tell your hands to withdraw and then to escape from that danger. So in future, if you see some things like sharps or a knife that could injure your body, you will always try to escape from it. So actually, pain helps us to avoid the injury. So pain can be divided into two types: acute pain and chronic pain. Acute pain is normally caused by the acute injuries. For example, a fracture, a broken bone, which can damage your blood vessel and nerves inside certain part. For example, you have a car accident, that's acute injury, and you have some object to penetrate your skin and making a wound. You have a bleeding immediately. That's all like acute injury. Chronic pain normally lasts for longer than 3 months. Chronic pain is normally caused by poor blood circulation. For example, you sit for long hours, for like 10 hours in the same position, and then you will suffer chronic back pain because you don't have a good blood circulation around your back. So chronic back pain is normally caused by poor blood supply or poor blood circulation to certain areas in the body, like a muscle spasm, muscle tension, like a shoulder pain. So how to treat the pain? For acute pain such as a fracture, normally because acute injury will cause immediately inflammation. So when there's an acute wound or fracture, now the injured area, the blood vessels to the injured areas will be dilated, and then the blood flow to that area will also increase. And also, the white blood cells will then be sent to the injured site to fight against the injury and the pathogens. So this whole reaction is called inflammation. So normally acute wound will cause inflammation, and because the blood vessels will dilate, so the acute injury will normally have a swelling. Now, when there's swelling, how do we treat it? A good treatment is to use a cold pack or the ice pack to apply on that injured side, on the swelling side. So cold pack could constrict your blood vessels, make it narrow, and then reduce the amount of fluid that leaks from the blood vessel, and then further reduce the swelling. So if there is acute injury, like I said, there is normally a swelling in that area caused by the inflammation. So we want to reduce the swelling, so we will use ice pack or cold pack. So if someone have a fracture related pain with a swelling hand or swelling arm, so we need to apply cold pack or ice pack on that swelling part to constrict the blood vessel and to reduce the swelling. However, if patient has chronic pain caused by poor blood flow to certain body tissue, then we need to use a heat pack. Like use a water bottle filled with hot water, or use a heat pack. Now the heat pack can be applied on that painful areas to promote the blood circulation in that areas to treat the chronic pain. So chronic pain, like I said, is normally caused by poor blood circulation. So when there's a poor blood circulation, normally the blood vessels is constricted, is narrowed. So less blood could flow into that area. Then if we apply the heat on that area, the heat can dilate the blood vessels to promote more blood supply to that painful areas, to treat the pain, to relax the muscle, relax your body tissues. So again, cold pack is to treat acute pain, especially fracture pain, can reduce swelling. And heat pack actually is used to treat chronic pain, can promote the blood circulation, promote the blood supply to that area. So they use for different reasons. And also, we can give medication to treatment. There are some quite common medications I want to introduce to you. If your pain is only light, if you have only mild pain, you should consider just using paracetamol. Paracetamol helps to treat light pain and help you to reduce the fever and also promote the sleeping. Paracetamol can be bought from like supermarket easily, and it's very cheap. Now, there are a few different other medications, including aspirin, ibuprofen, naproxen, and diclofenac. Now, these medications, aspirin, ibuprofen, naproxen, diclofenac, these medications, we call them the non-steroidal anti-inflammatory drugs. So these medications can treat the pain caused by the inflammation. Inflammation can happen in the body due to the invasion of the toxins or the pathogens like the bacterial infection or the virus infection. Now they all could trigger your body to have the inflammation. Then if you have an infection or inflammation, you will suffer from pain. And these medications could reduce the inflammation and then treat the pain. Aspirin, ibuprofen, naproxen, and diclofenac. These are very common medications, especially aspirin and ibuprofen. You can also easily buy them from the pharmacy without doctor's prescription. So you don't need to see a doctor to get a prescription. You just can buy easily from the pharmacy. And they are very cheap as well. So how do these medications work? Now, when you have inflammation, for example, when the bacteria or virus invade into your body and cause an inflammation, normally if something actually cut your skin and causing a wound. Now, normally the injured wound, injured like skin or the body tissue, will start to release some substance which is called the prostaglandin. prostaglandin. Prostaglandin is a chemical which will be released by the injured tissue due to the inflammation. Now, these medications, the anti-inflammatory drugs, these medications can block the production of the prostaglandin and then further reduce pain, because this substance could make patients feel more painful when there is inflammation. So again, the three very common medications I want you to remember are paracetamol, aspirin, and ibuprofen. They are very effective in treating mild fever, reducing the temperature, helping with slight pain, reduce the pain level, and also paracetamol can also help you to sleep better, have a better sleeping as well. If the pain gets really worse, if this medication actually don't treat your pain enough, then you could consider using stronger pain relief. A very common strong pain relief is called the opioids. Opioids medications, they must be prescribed by the doctors. Without prescription, you cannot access it. Opioids medication include several strong ones, such as indone, morphine, indone, morphine, or codeine, or fentanyl. So mostly that the doctor will prescribe indone or codeine to you to take as oral tablet. Morphine and fentanyl normally will be used as injection to treat very serious pain. Now, opioids pain relief medication, they are much stronger than these light pain relief medications, because they actually can work for your brain, work on your brain to make your brain has less sensation about the pain. There's one receptor in the brain which is called the opioid receptor. So opioids medication, they can attach to that opioid receptors to make your brain have less to make your brain feel less sensitive to the pain signals, so you cannot feel much pain after you take the medications. However, these strong medications could cause addiction. So when people start to take this medication, it will cause a high risk of addiction. People could get addicted to it. Therefore, only when you have strong pain, very serious pain, you will consider these opioids medications. Otherwise, you can just use common medications to treat a mild pain. So I hope you could have a better understanding about pain management for this little lecture. Thank you very much.